everyone, and welcome to the Art of Leading, captivating leadership narratives, all part of the stuff that growth is made of. I'm excited to introduce you to Elizabeth Nielson. Elizabeth is the CEO of Fluence and a member of my Vista CEO peer advisory group. Hello, Elizabeth, and welcome.
Hi, Margaret.
I'm so glad to be talking to you today, and I'm excited for our listeners to have the opportunity to hear from you and hear from your leadership journey.
Thank
So what I'd love to do is I'd love for you just to share, just kind of to set off as an overview of your company, which people are going to find very fascinating, and the services that you provide.
Yeah, sure. Well, thank you so much for inviting me to have this talk with you. I know we talk about these kinds of things fairly often, but it's really nice to have a time to really sit down and focus on it. So I am a founder and CEO of a company called Fluence, and we are a training and education services company. And we work in the space of training clinicians and psychotherapists for the emerging psychedelic therapies, mostly in mental health care, and also adjacent diagnoses. So I came into this work as a clinician myself, as a researcher who's worked on clinical trials of psychedelic therapies at some major institutions and with some of the really leading organizations in the field, and decided about 5 or 6 years ago now that there was really a need for some organized, professionalized training that could be accessible to clinicians and also very scalable, because you really need that if you're going to successfully roll out a treatment like this to the large numbers of people who are really potentially in need of it, should there be an FDA approval. And so I created this company. I've been working on it for several years now, and we've been successful in establishing ourselves as a program and creating technological solutions to help solve this problem of training and scaling and really delivering this in a way that's rigorous and at scale.
And so you're working with pharmaceutical companies? Who's your target audience?
Yeah, that's a great question. So we actually have two main types of primary audience or primary customers. The first type is individual clinicians who are interested in learning. They want to be up to date with the most cutting edge therapies. They want educational courses from a qualified continuing education program, and to learn how to do things up to date that are within their scope of their existing practice, right? So psychologists, social workers, all those folks. And we're approved providers of those kinds of continuing education, and people can come and take those courses with us and learn. The other main type of client that we have is drug developers who are developing psychedelics or related types of treatments. And they're taking those through the FDA approval process. So they're running a series of clinical trials where they're providing, a limited quantity of treatments and in very specific, very well-defined circumstances. And they need us to come in and help consult with them on that, and then also to train all the clinicians who work on those studies. So if you've got to run a study and you want to have 60, 70, 80 research sites, each with half a dozen therapists, and they all have to be able to do the same basic treatment in a similar way, you really need to be able to train people in a way that's going to be documented and aligned with that, and give them the skills that they need in that environment. And that's the kind of work that we do.
It's so interesting. And then one more thing, because then I want to get into your leadership journey. So, this is a topic that, I know after meeting you, I feel like it's everywhere in terms of, things written up about it. What is the regulatory status? What are your thoughts in terms of what the next steps? Is this something you think will become approved in the next year or two? And again, I know you don't have a crystal ball, but what's your view in terms of
Yeah.
the
Well,
maturity of how this is all going?
Yeah, I've been in this field as a clinician and as a researcher since 2014. So I've been really a part of what we could consider the sort of modern wave of research and development. And most of the psychedelics that people are talking about when they're talking about psilocybin or MDMA or LSD even, they're talking about compounds that are Schedule 1 drugs in the United States, which means they have no accepted medical use and they're considered highly dangerous. Now, that's the government classification. And in a way, that makes it a little more challenging to get funding and to get regulatory approval to even do this kind of research work, which is an important thing to keep in mind. Now, there are some caveats to what I'm going to say, but the general gist of it is that there are several dozen small companies that are working towards studying these types of compounds or related compounds for a variety of different indications. And many of them are in phase 2 and some even in phase 3 clinical trials, which is sort of the last step before receiving, applying to receive, and then potentially receiving marketing authorization approval from the FDA, the Federal Food and Drug Administration, which means that they can then be scheduled and become prescribable drugs. So there are several steps along the lines, but there has been a clear trajectory of progress towards that. And it is possible, it is realistically possible that in the next year, 2, 3 or so, we will start to see those kinds of approvals and regulatory changes. And then these compounds, which are now unavailable for any use outside of a research study, becoming available through the medical healthcare system.
Well, thank you for sharing that. And again, I want to make sure that our listeners have some baseline information, even on what your company and all of that. So let's transition a little bit to you and your journey. I'd love for you, Elizabeth, to share a little bit about your leadership journey that led you to where you are today.
Yeah, sure. Well, I think one of the most important things to keep in mind is, everything that we do is sort of within the system of mental health care and medical, medical approvals within the scope of practice. There are a lot of things going on in the field outside of that. Of course, there's spiritual use, there's use for personal growth. There are jurisdictions where these same compounds have been decriminalized. And so there's just a very rich environment going on, and Fluence as an organization sort of holds this one piece of it, but we're not the entire landscape. So I want to kind of give credit and voice to that, to give some space to those other ideas and ways of approaching this work that are out there. And I think that really speaks to my background and how I got into this. I came to this field as somebody who was a psychologist who was just finishing very long trajectory of graduate and PhD studies. My passion and my interest had really been in creating and developing better ways of working with people who are struggling with addiction and with PTSD. And so I had just a lot of practice and a lot of study and a lot of supervised work experience that one gets along the course of these programs, working towards understanding the best that the field had to offer at the time. But I never really felt satisfied with what those options were. They always seemed limited or in some way not really accessible to folks. Like, the treatment could be so daunting to people that they would never sign up for it. They would just continue to suffer with what they were suffering with. So around 2014, actually, when I was just about to finish my PhD, I saw a notice that someone was looking for researchers to join a research study of psilocybin, which is a naturally occurring psychedelic compound found in mushrooms. And they were looking at this as a potential treatment for alcohol problems. And it really spoke to me because I knew that some of the history of psychedelic research, that, similar compounds used to be used in treatment in the United States and abroad, of course, for treatment before they were banned in the late 1960s. And I knew that there was some history there, and I felt like this was something that was really worth getting into and exploring more and researching more. And fortunately, I had the background and the education to be able to join a research study and do that kind of work. You have to have quite a curriculum vitae ready of qualifications to do that sort of thing.
Yeah.
So I was very fortunate to have that opportunity, and I continued with it. I stuck with it. I studied. I got a postdoctoral fellowship to be able to dedicate 2 full years of time to that work. I continued to read and publish and write and go, more into those studies. Volunteer my time with other organizations and studies, and eventually that did start to turn into really a full-time work in this field. And it was rare back then. I mean, there were many people who were not willing to sort of go that route. It was considered professionally risky. Alongside that, I've just always had an entrepreneurial bent to my to my nature. And so when thinking about what else can I best do to contribute to this work and to this field, I had a feeling eventually it would be something in business and in business leadership, creating an organization, creating some way of sustainably contributing through the creation of a business organization.
It is a journey. I mean, again, the amount of education and all the different things you did to get where you are, it's a lot of heavy lifting. So hats
Yeah.
off to you and congratulations. Also, it's interesting because since we've known each other, you've been, again, the co-founder of this company, but recently became the formal CEO. You were doing a lot of the heavy lifting before that. So if you were to go back in time, what advice would you give your younger self when you look to see where you are today?
I think I worked really hard through my 20s, my 30s. I mean, I still work really hard today, but I didn't always see that there was going to be something more spacious and more creative and more inspiring and fun at the end of that. Um, I think that I wish that I had maybe just a little bit more optimism and hope for things to evolve and get better. I did a lot of jobs that were really challenging and really hard, right? Like I worked in community-based substance use treatment facilities. I worked in hospitals. Um, I worked in, I used to teach college courses, which very rewarding, but also a lot of work.
Yeah.
And so I'm really glad that I'm coming to this now with such a variety of work experiences and a variety of employment experiences, because I think that helps me. It gives me a lot of perspective and invaluable experience. But when I was doing those things, I didn't necessarily see that there was going to be something more fulfilling and better for me in terms of being just a better fit for my creativity and my passions
Yeah.
down the line. And I think if I had seen that, I may have felt more motivated and just more optimistic along the way. But I didn't always see that. It's hard
You
to
know,
imagine when you're in the process.
Absolutely. It's so interesting. I always found it, whether when I was growing up or when my kids were growing up, and there were some kids that from an early age knew exactly where they were going, what they were going to do, whether I'm going to be a doctor, I'm going to be a dancer, I'm going to be whatever. And I never really had that either. And we all wish it would be nice to have that crystal ball so you could say, okay, I could get through all of this stuff, but you just kind of want to know that you're going to be okay, or that there's something, that it's all going to make sense someday, but it doesn't
Yeah,
work
I
that
mean,
way. Yeah.
there's not necessarily really a clear career path to becoming a founder and CEO of a startup. There's no necessarily right way to do it. I think there's some ideas, there's some playbooks that people will tell you, you do this, you do that, you do the other thing, but really you get there how you get there.
You identify a need. You
Yeah, you
somehow, and
identify a
probably
need.
through all that hard work, working whether with substance abuse population, whatever, you
Yeah.
start to see a need that something's not being solved to help them.
Mm-hmm.
Yeah, that's so interesting. Thank you for sharing that.
Sure.
So, what were some of the challenges that you faced in your early leadership roles, and how did you overcome those challenges?
Yeah, it's funny. I came into being a leader in business from being a therapist, right? So I had that experience and background, and in a way there are some similarities. When you're a therapist, you're there for people sort of bouncing their experiences and what they bring to the session off of you. And the idea is that you're sort of in a way a blank slate, and you're reflecting that back to them. And I don't think many therapists adhere strictly to that principle these days. We bring a little more of ourselves than maybe some did traditionally, but still there's a sense that people are bringing what they've got on their plate in their life to the conversation, and the way that they see you reflects in how that conversation plays out, right? And so there is, I think, a little bit of that going on in business leadership. People have experiences maybe from previous employers. Maybe they have a certain relationship to the whole idea of working for an organization, or they have a certain relationship to the whole idea of working in medicine and in drug development or those sorts of things. And so they're bringing all of that to the table, and sometimes that can impact how they're relating to the leadership of the organization, right? Because you represent an institution, you represent something larger than who you are personally sometimes. So that can be a little bit challenging. And I think the experience as a therapist is really helpful there. All of that sort of supervision, being able to detect when that might be happening, when people are a little bit more seeing me through the lens of their experience versus what's truly at play in the room. And I think that's also an opportunity, right? Because if I can give people a good experience of working and being part of an organization, maybe then they continue to take that forward with them and relate in a positive way to future organizations and bring something positive there. So that's kind of how I would put it. I really enjoy being in this role, and I enjoy the potential to, also make friends with people who have been students, or to, bring former students on as employees and have a little bit of, possibility for different rich relationships that follow through over the years with folks in our community. And we do see that as a trend.
Yeah, I love that. So as a leader, what would you say today if you did a snapshot of what's going on? What's your biggest opportunity and challenge today?
Well, this is kind of it's a bit of a technical one, but I'll explain that in the drug development world and the clinical trials research world, very rarely has there been the integration of frontline psychotherapists, anything that looks like a psychotherapy or a treatment manual. Usually it's give people the dose of the medication, randomize them into a couple of groups, and then test and measure for outcomes. And those very, very biologically based measures. And so this is a little bit different, because a lot of the psychedelic treatments require a trained person who is doing some supportive preparation work with the individual who's going through the treatment, the person who's there with them during the session, and then, afterward for some follow-up integration sessions, or we just call them follow-up sessions sometimes. But there's a training, and there's more of a relational element to it. And the drug development world is not necessarily used to incorporating that. And most mental health care providers are not trained for or used to working in that environment. So we're kind of bridging those things together and trying to create a system and an infrastructure whereby we can train mental health care providers who have a wealth of experience and passion and great training, by and large, are just motivated people to be there for others, and help them get the skills and be able to work within that maybe more regulated environment, and bring their expertise into it, and really interface between those kinds of folks and kinds of organizations. So our platform is designed to help provide that rigor and quantifiable level of training in a way that's compliant with the needs of, regulatory needs of research studies, and can give those research studies the kind of tracking data and the kind of feedback that they need to demonstrate that everything was done really according to the manual and according to the books.
Yeah.
So that's the challenge. It's also the opportunity. We're really unique in terms of being an organization that can do that.
Oh, it's interesting. And again, it's new and you're setting some of the standards, which is pretty cool from an opportunity perspective.
Yeah.
Yeah, very interesting. Thank you. So, how, as you look at your success as a leader, how do you measure that? How do you know, you know what, I'm making an impact. I'm doing, I'm having the success or the impact that I want to have.
Yeah, it's a great question. Sometimes I'm a little isolated from the feedback, but my team members are often speaking with frontline, other trainers and other students and people coming through our programs. And I'm often speaking with some of our drug development partners. And one way I can tell is people come back. We have partners who are drug developers who have worked with us over not just one study, but a second, a third, a fourth, right? And continuing to add on additional services or continuing to expand the number of things off our menu that they are working with us on. And to me, that's a sign that, okay, we're doing something well here. We're doing something right. Our team is providing a service is really helpful. We see the same thing on the continuing education program end, so we'll have people that come for a webinar and then they come for an on-demand course, and then the next thing you know, they're in a certificate program. And we've built the systems on the back end to be able to see that. And it's not just like I want to download some marketing data exercise. It's really because we want to be able to tell, how are we re-engaging people? Who is being re-engaged? What is it that keeps people coming back? What is it that keeps them sort of referring their friends or referring other businesses to us? And so I always think of it as that's really the key to success. Are people coming back? Are they recommending us to their friends? And we see a lot of that, and it's a small world. So we
Mhm.
really do need that. I don't think we would be doing so well if that wasn't sort of naturally, very naturally happening.
Well, I love that. So it's really the voice of your team, the voice of the client, and then you have metrics that's showing
Mhm.
is there repeat business, things like that that's
Yeah,
coming,
yeah,
which is great.
yeah.
So changing topics a little bit. So if I look at my own journey, I'm old, much older than you. I think about and I have tried to be a good mentor and sponsor of others because I feel like I've really had some great mentors and sponsors in my career that made a huge difference. Would love for you to share, what impact or what role as mentors and sponsors had in your career, and any advice you'd give to some of the listeners who are joining us today.
Yeah, I thought about this actually before we got on the call, because I think it's a really great question. I was reflecting on it. The people that I really looked up to and admired as leaders in my life always were those that really encouraged the growth of people in their community and people around them, people who were their juniors in their organizations. And I think that these are the people that would actively recruit and sponsor others to get into the field and take opportunities and figure out what they could do to support them. And in a way, our organization is very much about that. We're constructed to be a place where we welcome people into the field. We, help them get through the basics, help them get oriented, help them get connected to others, right? So that the whole organization is really has that mentality of being sort of a sponsor or a mentor.
It's true. It's so true.
As
It's an interesting way
part
to
of
look
where we're
at it,
sitting.
but it is. You're trying to help them be
Yeah.
successful in this new area. Yeah.
That's how we
Yeah.
conceptualize the organization, because back when we started, this is maybe less so the case now. Back when we started, education and training in this field really wasn't accessible outside of maybe if you're working at a major academic institution and they happen to be doing a research study. So really there weren't a lot of sources, and there were not a lot of really good professional sources. And it felt like there were a lot of people that had great talents and wanted to get into the field, but there wasn't there was no pathway. So
Yeah.
we tried to really conscientiously create that, and it's been adapted over the years and everything. And but that comes from my experience of, who did I look up to as a leader? And it was always the people that were trying to welcome everyone in and help folks get connected. And that to me comes from what I would call like an abundance mentality.
Hmm. Love
There's
that.
there's room for more people here. There's room for, more perspectives, more backgrounds, more diversity, more people with different kinds of life experience, and that actually enriches everyone, as opposed to being a gatekeeper and a, like, well, we gotta like watch the door and make sure we don't let too many.
Competitor. It's not about
Right, and that's a more of a
competition. Yeah.
competitive mindset, and so that just kind of speaks to like how, again, we go back to how does one view the world and the institutions within it. But my perspective has always been that, and I've always tried to emulate that, certainly in terms of just like personal mentoring, or the people that I might be speaking to, like that I'm, maybe coming to me for some mentoring or some guidance, but actually the whole organization is designed that way.
It's that whole topic of abundance is very interesting. We could have a whole separate conversation about that, but I love that you brought that up. It is a very different outlook that will provide different outputs because of it, and important. So so thank you for sharing that. That's really interesting topic, and something that has been written a lot about over the last few years. So changing topics, I always love to hear what leaders, how they're staying sharp, what they're reading or listening to right now. It could be something leadership, it could be something more fun. So what do you do in your spare time to either sharpen the saw or to relax?
Well, my peer group has made some great book recommendations, which I think have been really eye-opening for me. I'm not coming from a formal business education background at this point, so I've made a few. I think I've made a few selections off that list. Probably just some of the classics that I never picked up on. But honestly, I'm often reading documents and writing emails, and my days can have a lot of verbal communication going on in them, a lot of language and a lot of thinking. So when you ask what are you listening to, often I'm listening to music because it gives me a sense of shifting out of that thinking mode, and kind of letting my thinking mind relax for a little bit, maybe feeling some rhythms, or feeling a shift in my mentality to help kind of integrate the experience of these very intensive days of running the
Yeah.
business and talking with folks all day. So that's what's coming up for me, and I think that's helpful to have a balance and a shift, because if you stay in the same mindset
Absolutely.
all day, all the time, you're on the track to burnout.
Yeah. It reminds, like, sometimes when I can't sleep at night, I'll listen to a podcast, and it's a nonsense, but it totally changes my mood and relaxes me. So I totally get that.
Yeah.
It's important to have whatever that is. So, well, good. Well, first of all, it's been so interesting. It's always interesting talking with you, Elizabeth. I have one closing question. What would you say is or are the critical success factors or secret sauce to being an effective leader today?
Hmm. Um, I think we're really at a place where technology is bringing up a lot of interesting questions that every organization needs to be grappling with, and needs to be thinking about, like, how do we approach it, how do we use it, how do we incorporate it, um and the relationships within an organization are what make the organization, right? So thinking about these things, I'm thinking about, well, how are we using technology as an organization to facilitate relationships and to facilitate communication, as opposed to, are we just trying to replace our primary most talented folks? That's not the case, right? And I think that I think that's kind of one of the main factors that any organization needs to figure out these days. What is the organization's relationship to technology? Not just like whether or not your products are a tech product, but how are you using or not using technology to facilitate your relationships and facilitate working together internally as a team, and still valuing that team and developing that team even more, while also surrounded by all of these amazing tools that are available to us now.
Yeah.
We are a remote organization, and at the same time, we do prioritize getting together and having in-person meetups, whether it's just one-on-one or just a few people for lunch, or a few days of leadership meetings or team meetings periodically, so that we continue to develop those relationships and give people that face-to-face time. And I think that's critical. I think that's really valuable for everyone, and helps us all come together and do the great work that we do together.
Yeah, I love that. And I think that's a really great way to close and a critical success factor. So thank you for that. Well,
Absolutely.
Elizabeth, thank you for sharing your thoughtful insights around the art of leading. I'm so glad you have a seat at the table, in an important seat at the table in our peer advisory group. You've been a great addition this year. And I just want to thank all of our listeners for participating. This is the stuff that growth is made of.